How is an eyelid crease created?
It's generally understood that about half of people of Asian descent do not have an eyelid crease. So a common question I hear during consultation is about how they can get an eyelid crease or a double eyelid fold. Not having a double eyelid fold can make the eyes look smaller. The eyelashes can be barely visible, as well as make it challenging to apply eyeshadow. Now, these patients are motivated to make their eyes appear bigger and brighter, and I'll discuss how I help people who want to have an eyelid crease in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I'm well known for my work for both primary and revision cosmetic eyelid surgeries, such as treating under-eye bags and hooded eyes, as well as advanced oculoplastic procedures like eyelid ptosis surgery. I'm also known for eyelid surgery performed for specific ethnicities, such as keloid-prone darker skin types and Asian double eyelid surgery. An eyelid crease is formed through a natural connection between the muscle that lifts the upper eyelid, called the levator muscle, and the overlying eyelid skin. The point where this connection is made is where the eyelid folds when the eyes are open, thereby forming the eyelid crease. People without this skin-to-muscle connection don't have a defined crease. They may have a weak skin-to-muscle connection resulting in shallower crease or multiple shallow creases. A weak connection can also be seen as a crease that only forms some of the time, but it's typically not very deep. If someone doesn't have a natural eyelid crease, it can be created with surgery known as Asian eyelid surgery, Asian blepharoplasty, or double eyelid surgery. When I perform double eyelid surgery, I create a skin-to-muscle connection using sutures. During consultation, I show my patients how their creases would look like by pushing the upper eyelid skin back using a Q-tip or an instrument. This reveals what a natural crease would have looked like if someone were born with it, and serves as an approximation of how they will look after surgery. An individual's facial anatomy determines the shape of the crease, whether it runs parallel or tapers towards the inner corner of the eye. While non-surgical methods like taping or gluing the eyelids can temporarily create the appearance of an eyelid fold, surgery is really the only way to create a stable, defined, long-lasting eyelid crease. The adhesives used to do a double eyelid temporarily can irritate the skin, and the constant removal of tape or glue can even stretch the eyelid skin and even go so far as the muscle that lifts the eyelid, which may require more extensive and expensive surgery than the usual double eyelid surgery which I routinely perform. There are two main categories for double eyelid surgery: non-incisional and incisional. Generally speaking, the anatomy and the age of the patient determines which technique is most appropriate for that individual. Excessive skin as well as prolapse fat can interfere with the formation of a defined crease that would reveal the natural shape of the eye. By performing incisional Asian eyelid surgery, I can precisely address these issues and create the connection between the skin and levator muscle to form the desired eyelid crease. If you don't need to have excess skin or fat removed, I select the non-incisional technique to create an eyelid crease. When I perform a so-called non-incisional Asian blepharoplasty, I'm actually creating some small openings through which I can place sutures to make a connection between the skin and the levator muscle. Generally, the non-incisional technique is indicated for younger patients, as well as older patients who have had previous eyelid surgery and no longer have any excess skin. I routinely perform these procedures under local anesthesia and light IV sedation in my office operating facilities. My patients appreciate not having to be under general anesthesia and thereby avoiding the associated risks and complications of general anesthesia. Our patients typically return to work in 1 week or less with minimal swelling depending on the type of procedure they have. Aftercare consists of the application of cold compresses and antibiotic ointment for a few days. So with a better understanding of how eyelid crease surgery is performed, you can now learn more through a proper consultation with an experienced surgeon with expertise in Asian double eyelid surgery. A natural double eyelid can reveal the true shape of the eyes while maintaining the characteristics specific to your ethnic background. I hope you found this information helpful. Thank you for your question.